I'm the president of the Washington State Nurses Association and work clinically as an urgent care nurse practitioner in Everett. 1 year ago today, I stood among many of you to sound the alarm about the challenges that our state and nation would face as a result of harmful health policy decisions and the politicization of healthcare in Washington, D.C. While I can say that many of our concerns were correct, so many of these destructive acts have been implemented with speed and recklessness, all at the cost of human lives. At the same time, I've seen our communities and our science allies stand together and push back against these acts with courage and conviction. And that gives me hope as we see ourselves through the chaos that we're dealing through right now. So I want to start with something simple. Every day, nurses and healthcare workers walk into clinics, hospitals, and community health centers and patient homes with an important principle. We rely on science and evidence to care for people. Not political talking points, not misinformation, and not ideology. When a patient comes to us with fever, cough, or a rash, or a life-threatening illness, we're not asking ourselves which political narrative is convenient right now. We ask, what does the evidence say? What does the data show? And what will help this person right in front of me get better? For more than 2 decades, nurses have consistently been ranked the most trusted profession in the United States, and that trust doesn't come from status or authority. It comes from the fact that nurses show up every day with a commitment to care for people and not to push a political agenda. Our loyalty is to our patients and the science that makes modern medicine possible. But today, that science continues to be under attack. Across our healthcare system, we're seeing decisions made by political leaders that undermine the very scientific infrastructure that clinicians rely on. From the rhetoric of RFK Jr. to leadership changes across federal health agencies, we've watched how confusion and chaos ripple through our institutions that are supposed to protect public health. We've seen a collapse of the integrity of the Advisory Committee on Immunization Practices, which historically has provided clear, transparent, and reliable scientific guidance. We've seen interference with the work of the CDC and other public health institutions. And these may sound like abstract policy debates in Washington, D.C., but I'll tell you something as a frontline clinician, these decisions don't just stay in our nation's capital. They show up in our exam rooms, they show up in our emergency departments, and they show up throughout our communities. In my own county of Snohomish County, which has been designated as a region with a measles outbreak, I've also seen pertussis, also known as whooping cough, more regularly than I should in any other country with modern vaccines. These are diseases that science has given us the tools to prevent already. But when public science is undermined, when public trust in science is undermined, when misinformation spreads and scientific institutions are destabilized, those consequences become very real. Nurses are the ones standing there at the bedside when those consequences arrive. I'm pretty sure that RFK Jr. isn't donning scrubs or dealing with the direct consequences of his actions on real individual lives. It's the nurses, physicians, and healthcare workers that do this and also pick up the pieces of his bad policy. And that's why nurses are speaking out.
Justin.
In this state, the Washington State Nurses Association has supported the West Coast Health Alliance, which has preserved access to vaccines and recommendations here in the West Coast. And we've refused to bend the knee. Shortly after the new administration took office, a flurry of executive orders went out targeting DEI, which also affected a large number of basic taxpayer-funded clinical resources on infectious disease, minority health, women's health care, and other websites were taken down. Some of these tools I actually used in my clinical practice, and when I clicked on the website, it wasn't working. Last May, the Washington State Nurses Association joined a coalition of 8 other health associations in suing RFK Jr. and the federal government. And we demanded that they restore these databases and resources. What happened? Last September, the federal government settled that lawsuit and restored those health databases. And that victory matters. because it shows when we defend our values and our practice and meet unprecedented situations with unprecedented action, we can be successful in protecting our patients and the achievements of science. But I will tell you, litigation alone is not enough. Standing up for science requires all of us. Nurses have never been passive observers in history. When communities face danger, nurses step forward. We did it during pandemics, we did it during wars, and we did it during natural disasters, and we're doing it now. We are not going to back down from protecting our patients and our communities. We're going to accept a world where scientific evidence is treated as something that's not optional. And we are not going to allow misinformation to replace the knowledge that has saved millions of lives. All of this will require courage. It'll require some clarity. And it'll require people speaking truth to power, especially during turbulent and chaotic times. So my message is simple here. Be bold, be brave, be clear-eyed about what is at stake. If you care about science, speak up. Write op-eds to your local papers, contact your legislators at the state and national level, and thank the lawmakers that are standing up like Congresswoman Schreier in making sure that science still has a role to play in our federal government. Support and be active in organizations like Stand Up for Science. Talk to your neighbors and your community members, and most importantly, please vote in every election. Because science needs advocates, not just in laboratories and hospitals, but in our civic life. The stakes are too high for silence. The health of our communities depends on this. And I promise you, nurses will continue to stand up for science with all of you. Let's keep moving forward with our values held close and our commitment to defend those values moving forward.